history of polarity therapy begins with Dr. Randolph Stone, an American osteopath from the 20th century. Dr. Stone immigrated from Austria when he was 11 years old and grew up and went to osteopathic medical school in the Chicago area, where he had his practice all of his life. Late in his life, Dr. Stone moved to India and retired there to live out his years at the feet of his master. As an osteopath, Dr. Stone understood the integrated nature of structure and function, but Dr. Stone always emphasized that there was something deeper in the approach to health. What was deeper in the approach to health was the essence of energy taking place in all the dimensions of health and wellness. That's what we'll explore in this program, and what Dr. Stone explored during his entire lifetime. He created an emphasis on energy in the healing arts. Dr. Stone sponsored seminars and endeavored to train other chiropractors and osteopaths and naturopathic doctors in his understanding of energy as the basis of the healing arts. What he found is that few of his physician colleagues were interested in the energy-based approach to healthcare, and later, Dr. Stone found a different audience in an unsuspected place. He started doing seminars in California in the late 1960s and found that a number of college students were interested in Dr. Stone's approach to health and healing. They were also interested in the spiritual import of Dr. Stone's message and the underlying emphasis on energy in healing practices. Dr. Stone was known for going on in his seminars. He would teach all day from 9 until 6 or 7 in the evening. He would take only a brief lunch of maybe some lemon juice in water or a handful of almonds, and then he would lay down for a 20-minute nap. After the end of a 10-hour seminar day, Dr. Stone would often treat patients, and he'd see 3 or 4 people in the evening. Many of the students would gather around the treatment table and pay attention to how he was conducting his clinical practice with his patients. The tireless aspect of Dr. Stone is one of the fascinating features in his life. Dr. Stone often commented on burning the midnight oil. That is, if you really want to understand something, you need to look deeply into it. You need to dedicate yourself to it, and you need to spend the hours, the time, and invest the personal interest to come to understand what's important to you. Remember, polarity therapy presents a defining model for all of energy medicine, and further, it's a specific clinical practice with its own techniques and skills. Polarity therapy began with the lifetime research and clinical practice of Dr. Randolph Stone. Dr. Stone was an osteopathic physician, and throughout his lifetime, he emphasized the importance of energy medicine. In some ways, Dr. Stone's principles and his discoveries in polarity therapy set a preview for the modern evolution of energy medicine. We've mentioned already how there are 3 main sources for the philosophy and the practices of polarity therapy. These are primarily ancient Ayurvedic medicine from the Indian subcontinent, the Hermetic medicine and sciences of ancient Egypt and the Golden Era of Greece, and traditional Chinese medicine. All of these practices and philosophies flowed together into one integrated approach, which Dr. Stone called polarity therapy. In this way, polarity therapy is a modern synthesis based on ancient traditions that have their experiences beginning in the mists before time. Dr. Stone kept his practice in the Chicago area throughout his life. He was known for being sent the trouble clients that other doctors were having a hard time with. The failures or the lack of success for other doctors got referred to Dr. Stone, and he developed a reputation for having remarkable successes with these otherwise intransigent conditions and difficult clients to work with. In the late 1940s, Dr. Stone was met by his later protege, Pierre Panetier. Pierre Panetier later became a naturopathic doctor in his own right, and he continued Dr. Stone's work as Dr. Stone's designated successor in the teaching and promulgation of polarity therapy. The interesting thing about Pierre Panetier's experience is Pierre started to emphasize the 5 elements much more strongly in therapeutic practice. Additionally, Pierre brought in the aspect of love and really focused on the importance of that in the healing process. Furthermore, the contributions of Pierre Panetier to polarity therapy include the focus of bringing in specific clinical practices and starting to work with hands-on relationships in particular places on the body in a much more particular way than Dr. Stone used in his own practice. Dr. Stone understood the philosophy, he understood the energetic relationships throughout the human energy field, and he described those in his writing and in his teaching seminars. However, Pierre Panetier started to focus those practices into protocols that could be learned easily by students and practiced effectively in terms of using polarity therapy. The standards for practice for the American Polarity Therapy Association were worked on by several committees of many different people over the course of years. It's a constantly evolving document, and the standards for practice are updated to keep pace with modern polarity therapy practices. The American Polarity Therapy Association is the original professional association for the therapeutic practice of polarity therapy. The American Polarity Therapy Association, or APTA, was founded in 1984. It was the first polarity therapy association in the world. So here we've explored a quick summary of the history of polarity therapy, starting with Dr. Randolph Stone and moving into his mentoring of Pierre Panetier, who codified the techniques and practices and brought them into useful protocols that could be studied by students. Then the evolution of the American Polarity Therapy Association, which gave integrity and a professional ground to the practices of polarity therapy. In recent times, there have been modern practitioners who have explored specialty applications, and what we see is polarity therapy is an ever-evolving field.